So today I'm mostly going to show you slides from the CDC data because they're really doing a nice job in terms of tracking now, and they've got some great comparative tools for folks as you are continuing to follow this. And this first slide shows you on a case per 100,000 the areas that are starting to see increases in COVID, with Puerto Rico being very high in terms of starting to have lots of COVID cases. And then you see it's mainly dominated by the Northeast, New Jersey, New York, and Alabama I included, but you can see we're still pretty flat relative to these others. If you look at it region by region, region 1 and 2 are the Northeast. And you can see that down here, it's the green and the purple, with the Northeast being, that's really the upper Northeast, and then kind of the middle part of the Northeast are region 1 and 2. We're in region 4, and region 4 is relatively flat still. So the Southeast is still relatively flat. If we look at the hospitalizations, the most interesting is to look at the region 1 hospitalizations, because that's where you're seeing the cases go up, and you are starting to see hospitalizations tick up in region 1 and in region 2. The most interesting piece is that they're ticking up in the older folks the most, at a rate that's a little bit higher from a relative standpoint to other age groups than what they've seen in other parts of the pandemic. Looking globally at who's increasing, the US, we're here in the red, which I like the way CDC is doing it, but you have to make sure that you look at in depth at the data to see what's happening, because you'll see the US is in the red here because we're substantial, have a substantial number of cases, and we're increasing. And you look at our curve and you can see that we are starting to go back on the uphill slant, but we're at about 94 cases per 100,000. On the other hand, orange, you might look at France and say, oh, they look great, they're in the orange. But when you click on France, sure, they're decreasing, but they're at 835 cases per 100,000, which is still substantial community spread. So you have to make sure to click on individual countries when you want to interpret this data. In terms of variants in the US, we're still primarily Omicron, with BA2 and then the newer BA2.1.2 kind of dominating the landscape. And it's pretty consistent across each of the various regions, although there are places where BA2 is still the more dominant. One of the most exciting things, and I think Russell will tell us this too, this is in Alabama, the biggest bottoming out of hospitalizations we've experienced and throughout the whole pandemic. We're very, very low for hospitalizations and have really stayed down at around 50 or 60 for a solid 2 weeks now. The state is primarily yellow and blue in terms of total number of cases and case positivity. On the next thing I want to show is the wastewater. Next week, we're going to start a pilot with Jefferson County and Dr. Leal's lab. 2 days a week, they're going to pull samples on Tuesday and Thursday. And then Dr. Leal should have results for us on Wednesday and Friday, so we can start getting a feel for how much SARS-CoV-2 is in the wastewater. Again, this is my favorite graph from UGA, because you can see here when you're at the nadir of the sewage, here we are on June 7th, the cases don't actually start to hit until July 14th. So it's a solid month all the way along. Again, here at the nadir, you're at November 10th, and cases aren't spiking until December 13th. The downside is that the nadir today, we've come out of it, and UGA is starting to show some increase in cases. Probably means that we'll see cases spike in the Southeast somewhere around the end of May. That's where we'll start going on the uphill slant if the UGA data holds as it has through the other surges. The reason I like UGA, CDC also has a map where they're tracking wastewater, but it's really difficult to interpret when basically it's dots on a map. You can see it does look like there's a hot spot going on in Chicago with the orange and the red, and maybe in the cities, but it's kind of difficult to interpret when there are lots of blue and some red, kind of exactly what's going on. That's why I really prefer this linear model, or where you can see the actual line that UGA is doing. But that's where we are. Overall, great. We're in great shape here in the southeastern United States, and we have to watch to see how what's happening in the Northeast starts to push down.